All my supplies are already on this table. Hi, my name is Maria and I'm going to be your student nurse today. Today we're going to be doing an abdomen and neurological assessment. So first we're going to start off with abdomen. So for that I'm going to have you lay down please and lift your shirt up just a little bit. Okay, and pull down your shorts just a tiny bit. Okay. So first we're going to start off by inspecting your abdomen. I see that your abdomen is flat. I see some breathing and slight vascular movement, so that's pretty normal. Your skin tone is appropriate for ethnicity. I don't see any lesions, any stretch marks. I don't see any piercings. I don't see any lumps or visible masses, so that's good. Everything looks good there. So now we're going to be auscultating for bowel sounds. Okay, so I'm going to be auscultating your abdomen. Okay. And this is going to be just a little bit cold, okay? And while I'm at it, I'm just going to be auscultating your aorta for brewery, okay? Okay, and I'm just going to be auscultating for brewery and your renal iliac. Okay. So there were bowel sounds present in all four quarters, and I didn't hear any brewery in your aortic or renal iliac. So everything sounds good there. So now what we're going to be doing is we're going to be percussing your abdomen, okay? And then we're going to be checking for splenic dullness, and then we're going to be checking for liver span, okay? So first we're going to start off with general tympani. So I'm just going to be checking for tympanic sounds. Okay, so I heard tympanic sounds all around. I'm just going to be checking for splenic dullness. Okay, so your spleen sounds dull, so that means that's good. So now we're going to be checking for your liver span. So first I have to locate your liver. Okay, so I'm just going to put a little marker right there. And then we're going to be looking for a resonant sound. Okay, so put another little marker right there. And now we're just going to be checking your liver span in centimeters, and it should be around 6, 7, around that area, okay? So it's right at 6 centimeters, so that's normal. Okay. So next we're going to be doing palpitations. We're going to be doing light and deep palpitations. And then we're going to be palpating for your liver, your spleen, and we're going to be checking for tenderness in your CVA, okay? So first we're just going to be lightly palpating. Let me know if you feel any discomfort, any pain.
Mm-hmm.
No pain, no tenderness?
No.
Okay, now we're going to be doing a little bit deeper. Let me know if you feel any pain, any tenderness.
Mm-hmm.
No? Okay, so everything seemed good there. I didn't feel any palpable masses or anything abnormal. So now we're just going to be palpating for your liver, okay? I mean your spleen. Okay, your spleen is not palpable, so that's normal. And now we're going to be palpating for your liver. So for this, I'm going to have you take a deep breath in and then breathe out for me. Okay, breathe in for me. Okay, so you can feel just a part of your liver, which is normal. Okay, so now you can put your shirt down and we're going to be checking for CVA tenderness, okay? So you can sit up for me and then face the camera, face your back to the camera. Okay, and I'm going to have you pull your shirt up just a little bit and I'm going to set my hands are a little bit cold, and I want you to let me know if you feel any tenderness when I hit my hand, okay?
No. No.
Okay. So that completes your abdomen assessment. Now we're going to be moving to your neurological assessment. So for this, I'm going to have you turn your body towards, yes, okay. So first we're going to be checking if all of your cranial nerves are intact. We're going to be checking for your olfactory, optic, ocular motor, trigeminal, acoustic, your glossopharyngeal and vagus, your spinal, your hypoglossal, and that's it, I think. Okay, so first we're going to be testing your olfactory nerve. And for this, I'm going to have you close your eyes and I'm going to have you close one nostril. And I'm going to be putting scents to your nose and I want you to tell me what they are, okay?
Mm-hmm.
So this is the first one. Take a deep breath in.
Vapor rub.
And close the other nostril. And take a deep breath in.
Candle.
Okay. Okay, so that nerve is intact. So now we're going to be checking your other nerves, okay? Mm-hmm. So for this, I'm going to have you follow the pen, okay?
Okay.
Okay. Okay. So now I'm gonna shine a light in your eyes to check for pupillary response, okay? And you can just look straight for me. Okay, so pupils are parallel. They're round, responsive, and everything. So now we're going to be checking your facial. So I'm going to have you smile and frown, and then I'll have you lift up and down your eyebrows. Have you blow up your cheeks and resist against my hands. Okay. So now I'm going to be doing a whisper test. So I'm going to whisper something in your ear and I want you to tell me what I say, okay?
1, 2, 3. ABC.
Okay. So now we're going to be checking your other nerve. So I want you to resist against my hands and lift up your shoulders. Okay. Turn your head, resist. Turn your head. Okay. So and now we're going to be checking your mouth. Can you please open your mouth? Okay, since we're not performing a gag test, I'm just going to look. Okay, your uvula is midline. Can I have you move your tongue side to side and up and down? Okay, and then I'm going to have you repeat after me. Tight, light, dynamite.
Tight, light, dynamite.
Tight, light, dynamite.
Tight, light, dynamite.
Okay, good. So all of your cranial nerves are intact. And now we're going to be checking for cerebellar function. So for this, I'm just going to be testing your gait. So I want you to stand up. You're going to walk to the camera. And then back. So normal gait, no no abnormalities with that. So now we're going to be doing a tandem walk. So I want you to walk heel to toe to the camera and back. Okay, then I'm going to be testing the Romberg gait. So I'm going to have you stand there with your eyes closed. I'm going to have my hands in front and behind you to just make sure you don't get dizzy or anything. Okay, there's some slight swaying, which is normal. Okay, so now I want you to touch all of your fingers. Okay, so now I want you to touch your nose and then touch my finger every time I move it, okay? Okay, so now we're going to be doing heel to toe, heel to shin, my bad. So I want you to run your heel down your shin. Same thing on the other side. Okay, so all of your cerebellar functions are intact. So now we're going to just be checking for spinothalamic tract. Okay, so for this, we're just going to be checking pain. And I'm going to be touching you with light and dull objects, and with your eyes closed, I want you to let me know if you feel a sharp or dull object, okay? So if I could have you close your eyes. Sharp, dull, dull, sharp, dull, dull, sharp, sharp, dull, dull, sharp, dull, sharp, sharp. Okay. So now I'm just going to be checking for light touch, and I want you to let me know when you feel it, okay?
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Okay. Okay, so now we're just going to be checking for position. So for this, I'm going to have you hold your hands out, and I want you to close your eyes, and as I move your fingers, I want you to let me know if I move them up or down, okay?
Up, up, down, down, up, down, 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 up.
Okay, so now we're going to be doing the same thing on your feet and your toes.
Down, 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 up, 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 down, up, up.
Okay. So your positioning is intact. Everything looks normal. So now we're going to be checking for tactile discrimination. And with that, we're going to be doing two tests. We're going to be doing the stereogenesis and the graphesthesia test. So for the first one, I'm going to be putting objects in your hand with your eyes closed. I want you to tell me what the object is, okay? So close your eyes for me. Okay, let me know what this object is.
Ring.
Okay, and this one?
Paperclip.
Okay. Okay, so now I'm going to be drawing things on your hands, and this is the graphogenesis test. So for this one, I'm going to be doing a number. Let me know what number it is.
1.
Okay, and for this one, it's going to be a letter, okay?
M.
Okay, great. Everything looks good there. So now we're going to be doing deep tendon reflexes. So for this, when I pull your limbs, I want you to just be dead weight, okay? And with this, I'm just going to be doing examples. I'm not actually going to hit her with this. Okay, so just dead weight for me, and then just tap right there. And I'm going to be pressing down on the tendon, tap, tap, and then the same thing on the other side. Dead weight, tap, turn, tap, tap. And then we're going to be doing the same things we're going to be doing the deep tendon reflex test on your biceps, triceps, brachioradialis, your quadriceps, your Achilles, and then we're going to be doing a plantar test, and then we're going to be checking for quadriceps, okay? So we're just going to be doing this on your Achilles, tap, tap, and then we're going to be checking for quadriceps. Okay, nothing there. So now I'm going to have you lay down, please. And we're just going to be checking your plantar reflexes. Okay. Okay. Toes curled, so that's good. So, and that completes your neurological assessment. Thank you so much for participating.